5 signs an elderly person may be in their final year, subtle warnings you shouldn't ignore. It is a profound human experience to witness the gradual changes in a loved one, especially as they age. Often the assumption is that the end of life arrives suddenly, like a swift closing of a door. However, the reality is far more nuanced. For months, and sometimes even a year or more, the human body frequently offers quiet, subtle indicators that life is approaching its final chapter. The challenge lies in the fact that these early warnings are so easily overlooked. They manifest as seemingly minor shifts in behavior or physical condition, easily dismissed as simply a natural part of aging. It is only in retrospect, as families look back, that the coherence of these clues becomes apparent, and with that realization often comes the regret of not having been better prepared. The opportunity to create lasting memories, to offer specific comforts, or to have important conversations may have passed, leaving a void where preparation could have brought solace. This video aims to illuminate 5 key signs that frequently emerge in the year preceding an elderly person's passing, signs that can empower families with knowledge and enable a more compassionate and prepared approach to this delicate phase of life. Understanding these indicators is not about succumbing to sadness, but about embracing the opportunity to provide enhanced care, to deepen connections, and to ensure that these final moments are imbued with comfort, dignity, and peace. By remaining attentive, one can navigate this journey with greater emotional resilience and practical foresight, transforming what might otherwise be a period of shock into one of mindful presence and loving support. Let us begin to explore these vital signals. The first and often most telling indication that an elderly individual may be entering the final year of their life is a noticeable and unintentional weight loss. This process can begin so subtly that it is easily overlooked. Perhaps it starts with a belt that requires an extra notch, or clothing that suddenly hangs a bit looser. Even a once robust appetite might begin to noticeably diminish, leading to smaller portions or skipped meals. Many families tend to rationalize these changes, attributing them to the natural course of aging, where metabolism slows and appetite can wane. However, significant weight loss that is not a result of intentional dieting is rarely a benign symptom. It frequently signals that the body's ability to absorb nutrients efficiently is compromised. Muscle mass, crucial for strength and mobility, begins to decrease, and the body's essential systems start to operate at a slower pace. While some loss of muscle is a common aspect of aging, a rapid or pronounced decline is a red flag, suggesting that something more profound is occurring internally. The digestive system might be struggling to process food adequately, or the body may no longer be effectively utilizing protein, leading to a condition known as muscle wasting. This loss of physical strength has far-reaching consequences. It not only makes everyday movements more challenging, but also significantly elevates the risk of falls, compromises the immune system, and leaves the individual more susceptible to infections. Beyond the physiological changes, appetite itself undergoes transformation. Many elderly individuals simply do not experience hunger with the same intensity as they once did. Their sense of taste can become dulled, diminishing the pleasure derived from food. As a result, meals may become a chore, leading to reduced intake. This shift is more than a matter of personal preference. It reflects a physiological recalibration. The body, sensing its impending transition, begins to reduce the signals that prompt the brain to seek sustenance. The consequence is a decrease in energy levels, a weakening of physical resilience, and a gradual decline in overall health. Furthermore, underlying medical conditions often play a significant role in this weight loss. Chronic illnesses such as cancer, heart failure, or kidney disease, all of which can progress silently for extended periods before more obvious symptoms emerge, frequently manifest with unintended weight loss as an early indicator. Even conditions like depression or cognitive decline can lead to a reduced interest in eating, initiating a downward spiral where the body is deprived of the necessary fuel to maintain its functions. In an attempt to counter this, some families may try to encourage increased food intake, offering favorite dishes or supplementing meals with high-calorie drinks. However, If the weight loss persists despite these interventions, it is crucial to acknowledge that the issue transcends mere dietary habits. It is the body itself undergoing a fundamental preparation for a deeper transition. At this juncture, forcing large meals may prove counterproductive. Instead, a focus on providing comfort, offering easily digestible foods, and ensuring adequate hydration can significantly contribute to maintaining a better quality of life. If you observe substantial weight loss in an elderly loved one, particularly when coupled with a decreased appetite, growing weakness, or difficulty in remaining active, it is imperative to take heed. This is not merely an aesthetic concern. It is the body communicating a vital message. Understanding this message early can empower you to approach the coming period with clarity, empathy, and the capacity to make each remaining moment profoundly meaningful. The second significant sign that often heralds the final year of life is a profound and persistent fatigue, a weariness that no amount of rest can alleviate. This is not the fleeting tiredness experienced after a demanding day, but a deep-seated exhaustion that renders even the most basic tasks overwhelmingly arduous. The simple act of getting out of bed can become a Herculean effort. Traversing a room requires immense exertion, and activities once performed with ease, such as preparing a meal, dressing oneself, or even engaging in a simple conversation, begin to feel excessively draining. This profound weariness is not merely a consequence of aging, it is a biological imperative. As the body begins to slow down, it prioritizes the conservation of its diminishing energy reserves. The heart, with its vital role in circulating blood and oxygen, may not pump as efficiently as it once did. This compromised circulation leads to muscles receiving less oxygen, contributing to a pervasive sense of weakness and unsteadiness. Consequently, many elderly individuals in their final months find themselves unable to sustain the level of physical activity they were accustomed to. Another critical factor is the metabolic slowdown that occurs. The body's energy production and utilization processes begin to recalibrate. As it prepares for its terminal phase, energy is redirected from fueling outward activity towards internal preservation. This explains why individuals in decline may spend significantly more time sleeping, requiring longer naps throughout the day, and finding it difficult to remain awake for extended periods. Some may even experience abrupt shifts in their energy levels, appearing alert one moment and utterly depleted the next. Perhaps one of the most emotionally challenging aspects of this pervasive fatigue is its impact on a senior's sense of self. Many individuals who have long prided themselves on their independence can become frustrated and even embarrassed by their inability to perform tasks they once took for granted. This can lead to social withdrawal, a reluctance to engage in conversations, or an abandonment of hobbies, not from a lack of desire, but from an overwhelming lack of physical capacity. This can create a detrimental cycle of isolation, where the individual may cease to attempt anything, thereby accelerating their decline. For families, witnessing a loved one transition from an active and engaged person to one consumed by exhaustion and withdrawal can be profoundly distressing. It is tempting to interpret this as laziness or to encourage them to push through their fatigue. However, the reality is that forcing activity is unlikely to be beneficial. What is truly needed is an understanding of their limitations, the grace to allow them to rest when necessary, and a concerted effort to make their remaining days as comfortable and peaceful as possible. If you observe that a loved one is experiencing a deep and unremitting fatigue that is not relieved by rest, consider this a significant sign of a major physiological transition. This is the opportune moment to cherish intimate conversations, to cultivate moments of serene companionship, and to offer unwavering support without imposing expectations. Ultimately, the value of these final days is not measured by the quantity of activities, but by the quality of connection and the presence of love and understanding. The third critical indicator that an elderly person may be entering their final year involves noticeable changes in cognitive function and social engagement, often manifesting as increased confusion or a pronounced withdrawal. Individuals who were once characterized by mental acuity and active participation in their surroundings may begin to exhibit a pattern of increased forgetfulness. They might struggle to follow the thread of conversations, appear disoriented even in familiar settings, or repeat themselves frequently. Forgetting names or losing track of time can become more commonplace, even if such memory lapses were not an issue in the past. These shifts, though subtle at first, can emerge months or even a full year before the end of life. It is important to distinguish this from everyday forgetfulness. The brain, like all organs, relies on a consistent supply of oxygen and nutrients to function optimally. As circulation diminishes and the brain receives less oxygen, cognitive processes begin to falter. This can lead to heightened confusion, difficulties in decision-making, and a struggle to recognize familiar people or places. In some instances, individuals may experience fleeting moments of clarity interspersed with periods of pronounced confusion, as if their cognitive processes are intermittently flickering. Alongside these cognitive changes, emotional withdrawal is a common phenomenon. A person nearing the end of life may experience a diminished interest in social interactions. They might speak less, engage less in dialogue, or spend extended periods in quiet contemplation. This is not necessarily a reflection of a lack of care for loved ones. Rather, it signifies a change in how the brain processes emotions and social stimuli. Conversations can become taxing, and environments with excessive noise or stimulation may feel overwhelming. Eventually, many seniors may retreat into a more internal world. Changes in mood and behavior are also frequently observed. Some individuals may become more irritable, anxious, or easily frustrated. Conversely, others might exhibit an unusual degree of calm, detachment, or indifference to matters that once held significant importance. This is not simply a personality alteration, but often a manifestation of the brain adapting to the body's overall decline. As cognitive processes slow, the ability to express emotions can become more challenging, and the individual may cease to react to situations in their accustomed manner. For family members, this stage can be particularly poignant and difficult. Witnessing a loved one appear to lose touch with reality or emotionally distance themselves can feel like a premature loss. However, it is crucial to recognize that these changes are largely beyond the individual's control. Rather than attempting to force them back into active engagement, the most compassionate approach is to meet them where they are. This involves speaking gently, offering consistent reassurance, and understanding that even if verbal responses are limited, your presence and affection can still be deeply felt. If you observe a loved one becoming increasingly forgetful, confused, or less socially engaged, do not dismiss these signs. They are often early indicators that both the body and mind are undergoing a profound preparation for the final transition. This period calls for immense patience, the cherishing of quiet, intimate moments, and the cultivation of an environment that fosters a sense of safety, familiarity, and peace. Even as verbal communication may fade, the power of love and comfort remains a profound source of solace. The fourth significant indication of a body preparing for its final stage is a discernible pattern of frequent infections and a marked delay in the healing process. As the body's systems begin to wind down, its ability to mount a robust defense against pathogens weakens considerably. You may notice an individual who rarely fell ill in the past now seems to be perpetually susceptible to colds, influenza, or minor infections that circulate within the community. Furthermore, illnesses that were once easily overcome now require significantly longer recovery periods, and even minor injuries such as small cuts or bruises take a noticeably longer time to mend. These changes are not random occurrences. They are tangible signs that the body's capacity for self-defense and repair has diminished. A primary concern is the recurrence of infections. Conditions such as pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more prevalent as the immune system's efficacy wanes. While families might initially perceive these as isolated incidents, their increasing frequency or protracted duration often signals a deeper issue: the body's diminishing ability to combat pathogens effectively. Even antibiotic treatments, which may have once provided swift resolution, might become less potent, necessitating stronger medications, extended recovery times, or multiple treatment courses for infections that previously would have been considered minor. This reduced responsiveness to treatment occurs because, as circulation slows and organ function declines, the body's overall response mechanisms are less effective. Another commonly overlooked issue pertains to chronic wounds. If you observe that minor abrasions, sores, or bruises are not healing properly or tend to reopen, it could indicate compromised circulation. Reduced blood flow means that essential oxygen and nutrients are not efficiently reaching the skin and underlying tissues, thereby hindering the natural healing process. For individuals who are less mobile, pressure sores can become a serious concern, posing a significant risk of dangerous infections if not meticulously managed. What is particularly concerning is that infections in the final year of life may not always present with the classic symptoms we associate with them. Instead of a high fever, an elderly person might simply appear more tired than usual, exhibit increased confusion, or show a reduced interest in eating. In fact, for seniors, a sudden decline in mental alertness can often be the very first warning sign of an infection preceding other overt symptoms. This underscores the importance of early recognition of these subtle changes, as it can significantly impact the comfort and support they receive during their final stages. For families, navigating a loved one's struggle with repeated infections can be both emotionally taxing and distressing. The instinct to pursue aggressive medical interventions, hoping that another round of antibiotics or another hospital stay will resolve the issue, is understandable. However, at a certain point, the focus of care often shifts from curative treatments to palliative comfort. Ensuring adequate hydration, maintaining skin hygiene and moisture, and minimizing stressors on the body can offer far greater well-being than further medical interventions that might only prolong suffering. The fifth and final crucial sign indicating that an elderly person may be in their final year involves significant alterations in breathing and circulation patterns. These physiological shifts are often among the most evident indicators that the body is transitioning towards its ultimate stage. You may observe that your loved one's breathing has become slower or shallower than usual. At times, their breathing might be punctuated by pauses, or it may adopt an irregular rhythm, accelerating and then decelerating unexpectedly. A particular pattern, known as Cheney-Stokes respiration, can emerge, characterized by a cycle of deep, rapid breaths, followed by prolonged periods of no breathing. While these changes might initially be subtle, they tend to become more pronounced and frequent as time progresses. Concurrently, a decline in circulation becomes increasingly apparent. You might notice that extremities, such as hands, feet, or even the nose and ears, feel consistently cold to the touch. The skin may take on a pale, bluish, or mottled appearance, particularly around the fingers and toes. This phenomenon occurs because the body begins to prioritize blood flow to essential internal organs, consequently reducing circulation to the peripheral areas. This is a clear indication that the heart's pumping efficiency is decreasing. Some individuals may also experience an increase in shortness of breath, even with minimal physical exertion. Simple actions like sitting up, speaking, or shifting positions can lead to feelings of breathlessness or the need to pause and catch their breath. If they were once capable of walking a short distance with ease, but now find such activity challenging, it suggests a decline in lung function. In some instances, fluid accumulation within the lungs can exacerbate breathing difficulties. This can manifest as a persistent cough, a gurgling sound within the chest, or a sensation of tightness. While families might attribute these symptoms to common congestion from a cold, in the context of an elderly person nearing the end of life, they are often indicative of weakening lungs. This can make lying flat uncomfortable, leading them to prefer sleeping propped up on pillows or in a recliner to facilitate easier breathing. Witnessing these changes can be alarming for family members. The natural inclination is to intervene, to encourage deeper breaths, or to fear an immediate medical crisis. However, in many cases, these are simply natural manifestations of the body's gradual slowing down. While reversing these changes may not always be possible, there are ways to enhance comfort. Maintaining a cool room temperature, utilizing a humidifier, or offering small sips of water can help alleviate discomfort. In some situations, medications or supplemental oxygen therapy may provide relief, but the primary focus of care often shifts towards ensuring comfort rather than attempting to cure the underlying issue. If you notice these signs, changes in breathing patterns, cold extremities, or a bluish discoloration of the skin, it is important to pay attention. These are often indicators that the body is conserving its energy and that circulation is slowing. This is a time for presence, for offering reassurance, and for cultivating a peaceful environment where the individual feels secure and at ease. In these final weeks or months, the most profound gift you can offer is not necessarily advanced medical intervention, but rather comfort, dignity, and the assurance that they are not alone. As we conclude this exploration, it is beneficial to reflect on the 5 key signs we have discussed: significant weight loss, pervasive fatigue, cognitive confusion or withdrawal, recurrent infections with slow healing, and notable changes in breathing and circulation. These indicators frequently emerge in the year preceding an elderly person's passing. It is important to remember that they may not all appear simultaneously, nor will they always be immediately apparent. However, when you begin to notice their presence, it signifies that the body is undergoing a profound preparation for its final transition. For many families, the acknowledgement of these changes can be emotionally challenging. The instinct to resist the inevitable, to encourage a loved one to eat more, to be more active, or to push through exhaustion is deeply human. Yet, at times, the most compassionate approach is to attune ourselves to the messages the body is sending. Instead of striving to reverse what is beyond our control, our energy can be redirected towards ensuring that the remaining time is as peaceful, comfortable, and meaningful as possible. Understanding these signs is not about succumbing to fear, but about embracing preparedness. By recognizing these changes early, you are empowered to offer more effective care, to make crucial decisions in advance, and to ensure that your loved one's final months are filled with love, dignity, and emotional richness. This is a period for cherishing shared moments, for recounting cherished memories, and for conveying to them their immense value and the fact that they are deeply loved and supported. If you are observing these signs in someone close to you, take a moment to breathe deeply and remember that you are not embarking on this journey alone. Countless families have navigated this path before you. While it is undeniably difficult, possessing an understanding of what to expect can provide you with the strength, patience, and inner peace needed to move forward. Thank you for joining us today. We genuinely value your engagement and would be delighted to hear from you. Please share in the comments below one significant insight you gained from this video and how you intend to integrate it into your life. Your thoughts and experiences are invaluable to us and serve as a powerful source of motivation and encouragement. If you found this video beneficial and informative, we kindly ask you to like, subscribe, and share it with others. Your support enables us to continue producing content that aims to inform and inspire. Thank you for watching, and we eagerly anticipate our next conversation.